Well, my name is Carmen James Amieso. I'm 41. Well, I'm a hip hop artist. One night I woke up and all of a sudden I couldn't breathe. My wife dropped me off in a nursing station. I gotta credit that nursing station for saving my life. They took these tests, EKGs, all sorts of stuff. And then that's when my life changed. The doctor sat me down. And he said, I think as far as my calculations go, you're at stage 5. Kidney failure. July 11th, 2019 is when I found out. It was one of the biggest and hardest pills for me to swallow, was when I found out about kidney disease.
What we found with patients who are on First Nations communities in northern Manitoba or really anywhere more rural or remote in Canada is they don't have the same access to primary care resources, and their disease burden tends to be a lot higher. So we really identified a need to get out to the communities and do community-based screening. Kidney Check started about 10 years ago. The precursor to Kidney Check was a project called Finished, partnership between the First Nations Health and Social Services Secretary of Manitoba and us at Chronic Disease Innovation Center, University of Manitoba, came together, developed a point of care testing algorithm, which finger prick for testing for kidney function, and a tabletop device for urinary protein. Created an iPad app where we input all of that data, come up with a risk for an individual patient in real time. Should they, just do lifestyle interventions? Should they see their primary care provider, or should they be referred directly to a nephrology care team? We rolled that out in a number of communities in Manitoba, and really that became the fundamentals of Kidney Check that we're now trying to roll out, nationally across, Ontario, Manitoba, Saskatchewan, Alberta, BC.
We don't go into communities and say, you got to do this, this, and this. That's not what we do. It's a wellness project to be able to go into communities and work with communities, in partnership with communities, on ways that will work best for them. Once you're tested, once you have, a finger prick, once you have the urinalysis, once you have a blood pressure check, weight, all of those things, and we put them into a model called the kidney risk failure equation, and it will tell us low, medium, high, risk, all of those things, no risk. And so once you know that, it just empowers you to be able to do something about your health. 1 in 10 people in Canada will end up with kidney disease. But in Indigenous communities, that number's as high as almost 1 in 3.
Kidney disease has been plaguing my nation, our nations, for years upon years, decades upon decades. And what's even more insane is I didn't know about that. I had to get kidney disease to know about that.
We're hoping that once we go into communities and leave them this information, that they're able to better understand their health. Once you know that you have kidney disease, then there are things that you can do. And those of us who've had kidney disease and we know what it's like. I go into communities and I tell my story.
We've had thousands of people screened. We've had an extensive publication stack around some of the outcomes. The program's cost effective. Qualitatively, the programs have been independently evaluated by communities and patients, showing generally really good acceptance of this innovative model of care. So really across a number of domains, awards, extra money and grants, our knowledge translation platform, I think we've received generally really positive feedback. The one thing we do want to improve on is really transitioning leadership of the program, transitioning sort of new directions for the program over the next several years, so that we can continue the momentum. And really the ultimate goal is a sustainable national chronic kidney disease screening program for First Nations people.
All the work that Paul and them are doing is monumental. I think it's phenomenal. And it's going to save a lot of lives. And it's going to help a lot of people understand there is a need for this. There's a point with kidney disease where you can be too far gone. And there's a point in kidney disease where if you find it early, you can do something about it.
And a project like Kidney Check and a screening project in our Indigenous communities is so vital for people's health, to be able to understand that. It's just, I can't express how important a project like this is to the health of Indigenous people. And to do it with Indigenous people and to be Indigenous-led is just so important.
If I knew, if I can go back and tell my younger self, then I would. But since I can't, I can tell these people, go get checked.